This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, it's another big news week in the state of Pennsylvania. We'll get to a couple of big issues that involves lots of voters and lots of interest in the state. But first, Dr. Stuart Shapiro, he's the CEO of the Pennsylvania Healthcare Association, one of the experts we call in from time to time to give us an update on all things healthcare. I like that, all things healthcare. All right, doctor, let's start with the budget. During the course of the campaign, Governor Wolf made it very clear that a primary goal of his administration would be to make healthcare more accessible. He supports the Affordable Care Act. He wants to change the Healthy PA program that Governor Corbett had to go to what we call a more traditional Medicaid program. What's your sense? You follow this very closely. What's your sense of where Governor Wolf stands now and where the big things he wants to do stand, given the budget and given other comments made by the governor?
Great. As you know, this is the beginning of the baseball season, so I'm going to. And it's spring, and spring's finally here.
Right.
So I'm going to put my cap on as an umpire.
Okay.
And I'm going to call balls and strikes as I see them, as I always do. But I'm going to put today's focus on the elderly.
Okay.
And I'm going to call it, "What's his budget do for the elderly?" I think he said during the campaign it was going to be a priority, and I think honestly I could conclude that the elderly are a priority. Do I think it could be? They could do a little bit more under Medicaid for the elderly and make it more of a priority, which is they're the people. I'm part of that crowd. I'm a baby boomer. You're a baby boomer.
We're all part, right?
And I want to make sure that the Medicaid program continues to serve the elderly because they're the folks who need it.
Yeah.
And the Wolf budget's a step in that direction. We look forward to working with the legislature as we move forward this spring to enact a budget that in fact does do it.
Now, put this in some perspective. We have the fourth largest senior citizen population in the country.
Right.
We're growing older just as we're getting younger with immigrants, and as everybody knows, and we have somewhere in the neighborhood of 500,000 Medicaid eligible people. Do I got that about?
More. But we have lots and lots of elderly. And the real issue is that the cost of care to be delivered at home or in a nursing home has gone up.
Right. And
the Medicaid program has to fund those increases. For example, I'm just going to pick nursing homes as an example. Their ability to take care of people on Medicaid has been dramatically diminished over the last several years because Medicaid has not kept up with inflation. Example, the federal government came out last week that the 3-year average of what it costs to take care of somebody, to buy the bed sheets and the towels and to replace things and to hire staff is about 2.5% a year average over 3 years. The budget doesn't provide those kind of money for nursing homes under Medicaid.
Right.
So we'll be advocating, as we always do, to help do that. People want to stay in their home. And I'm very, very supportive, obviously, as are you. We've talked about that. But Medicaid program has to look at this in a way of cost efficiency. When it costs less to stay at home, then somebody should be able to be supported by Medicaid at home. And there's 20, 30,000 people there.
Let me make a point. Let me make a point here. You raise it. Look, almost every week I talk to one of my friends who's dealing with a mother or a grandparent that needs to get out of the home into a facility because, we want the family to take care of them. You're right, but it can't always happen.
No, it can't.
And we don't talk about that enough.
And that's the problem. Right now there's 30,000 people, elderly people, good people, who are being supported by Medicaid at home. Now, and most of them can be taken care of at home because they don't need 24/7 care. And their average cost of care may be $18,000, $20,000, $25,000. When somebody needs that 24/7 care, they need to go into a place that could do that. and that costs, let's say, $50,000.
Obviously, it's more.
Of course it's more. But the government is also paying for about 1,100 people, where they're paying a lot more than $50,000 to give them 24/7 care at home.
Yeah.
And that doesn't make sense. Now, I'm not suggesting that any of those people be moved into a nursing home, but I am suggesting that this issue be looked at prospectively.
Lots of elderly folks who trying to decide whether they should remain in a home, go into a facility. Who makes that? Well, we know who makes that decision, but who pays for it? How efficient is it? I mean, these are incredibly important decisions that we don't think about until we have to make a decision.
One of these days, we should have a whole show devoted on how do people make those decisions.
Let's do that. That would be great.
But the reality is that people who are in their 30s and 40s ought to be talking to their parents or their grandparents when they're in the 50s or the 60s to begin to talk about this decision so that plans can be made. You could buy insurance if you want. You can look at your financial picture, and you can get ready for that day, which inevitably will come to all of us.
That's a great point. There must be some kind of avoidance on it, you know, where we just don't want to admit that we're getting older, that somehow that we just don't. And maybe some, you know, it's not just the parents, but maybe the kids are saying, well, I don't know if I want to go there. Should I bring this up? But, I mean, you're on to something here that we just haven't, that among the 10 decisions that we make in our life that really matter, wouldn't that have to be one of them?
But we also ought to plan for those decisions.
Yeah, that's what I mean.
And so we have to start, people have to start thinking about that today.
Yeah.
And people ought to be thinking about long-term care insurance. They ought to think about how they're structuring their own savings so they can make sure that they lead in their last half decade of their life where they live.
All right, we're going to do that. We're going to have you back at when it works with your schedule, and we'll get into that in some detail. There are a whole bunch of nuances to it. All right, before I let you go, I want to talk about the status of legal reform in healthcare. Over the course of the last decade, we've had discussions about tort reform, about changes that took place in Pennsylvania law. I read reports where suits against doctors are down, or at least court decisions, you know, at any rate.
Actually not.
All right, good, great. That's
let
why
me give you some. Let me give you 4 facts.
Okay.
If I can remember them all. Pennsylvania has among the best hospitals, doctors, nursing homes, nurses in the country.
I think everybody agrees with that.
Yet they're ranked as one of the most friendly to trial lawyers, plaintiff lawyers, to sue doctors in the country. Year after year after year, all the ratings of the Bar Association say Pennsylvania is a trial lawyer-friendly state. Third, Pennsylvania ranks 6th in population, but data's come out in the last 2 weeks that we're 2nd in terms of malpractice payouts and settlements. And the 4th is Pennsylvania ranks highest in out-of-state predatory lawyers who fly into Pennsylvania. They come from places like Alabama and Florida, and they come here like they're attracted here because of the other things like flies to flypaper.
Right.
And the fact is that against doctors and nursing homes, hospitals, they run ads, and in the last 60 days, there have been 30 full-page ads run by out-of-state lawyers trolling for business in Pennsylvania against nursing homes.
What is there about our state? Do we know?
Yeah, it's the juries in primarily Philadelphia and in Pittsburgh tend to award high damages. So what that does is force hospitals, doctors, and nursing homes to settle cases. And remember I said we were ranked 2nd highest in payouts?
Right.
Over 90% of that is settlements, not jury verdicts.
Wow.
And
sure, the insurance companies settle so they don't have to go through it.
Right, and if there's a case that they think they can easily win, they say it's easier so what this legislature needs to do is to enact some real tort reform. They need to put limits on punitive damages for nursing homes, perhaps hospitals, that already exist for doctors, because the nursing homes, while some suits in some counties are down for physicians, they're way up for nursing homes, despite the fact that the federal Centers for Medicare and Medicaid have said Pennsylvania's improved on 10 of 11 measures.
You just answered my follow-up question. Look, this was very helpful. Now I'm going to hold you to the promise to come in to have this discussion about this transition, which I think is critically important, and we'll keep following the whole business with tort reform and where all that goes. I thought it was having some effect, but you now tell me that not as much as we originally thought. But
there's been some effect, but nowhere near. And these out-of-state lawyers, they're coming here and they're making lots of money.